So we've made some changes to the appointment pre-screening policy, reflecting that we do not currently have a front desk manager. So the responsibility for calling the patient the day before the appointment will be up to the student clinician. So let's review this policy. So inform the patient that they will receive a phone call from you the day before their appointment to conduct the COVID-19 pre-screening. When they arrive or park for their appointment, they should call the clinic to verify their answers to the screening questions have not changed and give the phone number 978-656-3250. So when you conduct the pre-screening, make sure you have the pre-screening tool with you to fill out. On the day prior to the appointment, the student clinician will call the patient to ask the screening questions for the COVID-19 risk. During the call, the patient will be asked the COVID-19 screening questions according to the MCC COVID-19 screening questionnaire. The responses will be dated and documented by you on the screening questionnaire. If questions arise during the pre-screening, you will discuss with the supervising dentist or the director, Karen Townsend, who will then follow up with this patient. So those are the changes. So it will be the student clinician that will do that pre-screening instead of the front desk manager for now. Okay, so on the day of the appointment, the patient screener, which is either be the supervising dentist or another designee of the dental hygiene clinic, will be seated at the front desk. Give your pre-screening questionnaire filled out for each patient to the patient screener. If the patient was not reached for the pre-screening, you should still fill out a form and leave the answers blank so the patient screener will know to ask the questions in full. The patient will call the front desk upon parking and before arriving to the clinic. The patient screener will ask the pre-screening questions if they were not reached the day prior or ask if any of the answers have changed from the screening previously conducted. So this is the same. If the reception area is busy, the patient may be asked to wait for a return phone call. Answers will be updated, documented, and dated on the screening questionnaire. So when the patient arrives, a greeter, either the SCM or Rosemary Bagley, our clinical operations manager, will advise the patient to don a mask if they're not wearing one and to sanitize their hands. The patient will proceed to the front desk area where the screener is stationed. So here is a little something changed here. So before we said if temp under 100 degrees Fahrenheit and temp over 100 degrees Fahrenheit, we never actually included 100 degrees Fahrenheit. So if the temperature is 100 degrees Fahrenheit and over, the patient will be dismissed and referred to their healthcare provider. So those are the changes to that. And then we had to change, we may just cross this out and put this in pen because we have a lot of copies of this to include temperature 100 degrees Fahrenheit and over. So that's change on the pre-treatment and also on the post-treatment checklist to include the temperature of 100 degrees Fahrenheit. Keep scrolling. Okay, a couple of changes to appointment protocol. So biofilm, let's see, what are we doing here? Biofilm index. So when you perform the biofilm index and you put the dye on the patient's teeth, you could either give them a cup with water to swish and spit back into the cup. The fluid can then be disposed of by the student using suction and the cup disposed of in the trash. Do not pour the fluid back into the sink. It's to be evacuated with one of the high volume evacuations. You may also use water from the tri-syringe. The tri-syringe, that means it has three functions. So we could just express air, we could just express water, or if we push both buttons, we can create this huge mist of air and water, which we never want to do right now. So if you're going to use the tri-syringe, you only want to use the water, no air. So you use the water from the tri-syringe to rinse the disclosing, have the patient swish, and then you can suction the excess fluid from the patient's mouth. Okay, treatment planning. So this is still pretty similar. There's one change. And the one change is you will have a discussion with your instructor about the method that you'll deliver oral hygiene instruction to your patient. So you want to incorporate the instructor's feedback, including the method for delivering oral hygiene instruction to your patient. So let me scroll down a little bit here so we can look at that. So based on the faculty and student collaboration, oral hygiene instruction may be demonstrated in the patient's mouth prior to debridement. A disposable toothbrush can be used to demonstrate OHI, then disposed of. Please use a saliva ejector attached with a bullfrog to the HVE to control the amount of saliva. A new Oral-B toothbrush can be given for the patient to take home. As an alternative, the Oral-B toothbrush can be used for oral hygiene instruction and placed in a plastic sleeve for the patient to bring home. Additionally, demonstration on a mouth model and videos may be used. Now we're into chapter 4, just a few things in here. So I cut out most of it so we didn't have to scroll through 30 pages. So right now for students, you will wear a lab coat with your name tag. You do not need to wear an isolation gown over your lab coat. Instructors, faculty will change isolation gowns between patients. They'll hang them up in your operatory. If you happen to be using an isolation gown, when you remove your PPE, discard it if you're wearing one. So let me just, okay, lab coat should be removed and left in the clinical area. If you have an isolation gown on, it can be discarded. So our sequence for donning PPE will be a little different. So we'll do hand hygiene. You'll put on the protective lab coat, shoe covering, head covering, protective eyewear, face shield, hand hygiene, and gloves. I've removed the mask because you will have the mask on from when you've entered the clinical area and you've removed your cloth mask and put on the surgical mask. And then for removing PPE, gloves, hand hygiene, face shield, protective eyewear, head covering, lab coat, shoe covering, take the mask off, do your hand hygiene, put your cloth mask back on, and then hand hygiene again before you exit the clinical area. So let's go a little deeper into lab coats. So students and faculty will wear a freshly laundered lab coat to each daily clinic session. Students will change into a freshly laundered lab coat between patients. So if you're here all day and you have a different patient in the afternoon, you will put on a new lab coat. Faculty will wear disposable isolation gowns over their lab coats and change the isolation gown between patients. Because your name tag is now on the outside, you will not clean it with soap and water. You will remove it, clean, and disinfect with a disinfectant wipe between patients and at the end of each clinic session. So face shield. So when you're using a face shield to practice social distancing and working on a typodont, the face shield may be washed with soap and water, left to air dry, and stored appropriately. After patient treatment, face shields may be cleaned and disinfected with a disinfectant wipe or thrown away. Faculty will assist you with the best option. And then this is just a redo of when you enter Talbot. So start of the clinic day, add this start of clinic day, log into Trajexis. Because your clinic faculty will be checking to make sure that you've done your COVID-19 pre-screening prior to you entering the clinical area. So that is going to happen this week. So you need to log into Trajexis, answer the COVID-19 pre-screening. Your clinic faculty will check to make sure you've done this prior to entering the clinical area. Enter the Talbot building with personal face covering. Proceed to the locker room through the designated entrance. Maintain social distancing. Carry in your lab coat. Exit the locker room through the designated exit and proceed to the clinic. Perform hand hygiene. Remove cloth mask. Store in a plastic bag behind your unit. Be careful not to touch the outside of the plastic bag with the mask. Perform hand hygiene. Don surgical mask. So that's it for today. All right, I look forward to a productive week this week. and I'll see you soon.